What if we were to focus on the potential of getting our community interested in participating in their own health? What if there was a vibrant, interactive communication within a community that elicits responses and provides the ability for individuals and groups to take actions that will make improvements in specific public health challenges that we all face? How about increasing adult and teen physical activity? Providing and encouraging easier access to diets rich in fruits and vegetables, working together toward the goal of lowering obesity rates within the community. How would a community look with fewer children and teens at risk for gang-related activity, unwanted pregnancy, bullying, and tobacco, drug, and alcohol use? Imagine a community so vibrant, connected, and engaged that there is shared pride, a homeostasis with balance and self-correcting features, just like the homeostasis that balances the different systems within the human body to produce health. Would the result be a safer, healthier community where people enjoy life? Would you like to call this your community? This is the value of community feedback, engaging the public through action plans to form safer and healthier communities. The inspiration for this topic comes directly from an expanded goal developed by our team in creating this year's Public Health Department Community Health Report. This topic fits within the required guidelines for our class presentation assignment. In this year's Community Health Report, we will be offering evidence-based proposals for community participation, known as action plans, for each of the community health indicators chosen to be included in the report. When properly and clearly presented, these action plans invite community input and offer chances for all interested persons in our community to get involved in the ongoing process of creating a safer and healthier community for all. In addition to offering only a printed version of the report, as was done in years past, we will be utilizing available multimedia and social networking media, including scheduled PowerPoint broadcasts via public access television channel provided by our local cable company, as well as individual and library computer access to a health department page on a popular social networking website. So, what is a community health status indicator, and what goes into the making of a community health report? Somehow I knew this question would come up. Before we can understand what a community health status indicator is, we should review a working definition of public health. The question is, do we really need to do this? I mean, isn't this why we took these difficult community and public health classes and clinicals to begin with? Oh well. Public health is healthcare that focuses at the population and community level and spans from epidemiology and the prevention of infectious disease to environmental health and protection from hazards to health education and health promotion to health administration and quality assurance. Community health status indicators are data that help address all these aspects of public health. There's more? Another part of defining public health is understanding what are considered the essential public health services. Monitoring health status, informing and educating people about health issues, and supporting research for new solutions to health problems are what these indicators are all about. And finally, to conclude our review, the 10 essential public health services provide a working definition of public health as well as a guiding framework for the responsibilities of public health systems. The Public Health Functions Steering Committee, with representatives from the U.S. Public Health Service and other major public health organizations, developed the framework for the essential services back in 1994. Now that we have defined public health, let's focus on Community Health Status Indicators, or CHSI. What is CHSI? CHSI is a collection of nationally available health indicators for counties. helping to present a total picture of local health. It is a resource for monitoring and analyzing community health status and its determinants at the county level. The goal of CHSI is to give local public health agencies another tool for improving their community's health by identifying data resources and facilitating the setting of priorities. CHSI is a valuable resource that supports the mission and goals of public health, the 10 essential public health services, Healthy People 2020 initiatives, and evidence-based policy and research. As with any good journey, we start with a map, or for our purposes, mobilizing for action through planning and partnerships. MAP is a strategic approach to community health improvement that consists of a multi-year process. It is comprised of community partners and key stakeholders with the goal to identify and implement goals and strategies to strengthen our community's health. There are 6 phases to the MAP process. Phase 1 is organizing for success and partnership development. Phase 2 consists of visioning, or the development of a mission and core values. Phase 3 includes 4 MAP assessments, which are Community Themes and Strengths Assessment, Local Public Health System Assessment, Community Health Status Assessment, as we know, the Windshield Survey, and the Forces of Change Assessment. Stage 4 is the identification of strategic issues. Stage 5 goes into the formulation of goals and strategies. And finally, Stage 6 is the action cycle. This is a stage of planning, implementation, and evaluation. This action cycle will be familiar to nurses in that it is very similar to the nursing process involving planning, implementation, and evaluation. Prior to the start of the action cycle, however, the process of prioritization begins. This process of prioritization involves both the community and a statistical method known as the Hanlon method of prioritization. The Hanlon method was specifically created as a statistical method for prioritizing public health initiatives, goals, and strategies. It is this process of combining community input along with the Hanlon method that moves us into the action cycle and the development of CHIP, the Community Health Improvement Plan. Once the data for all potential community health status indicators has been collected and listed, the community vote now provides all willing community members with the opportunity to provide input on which strategies should be selected for the Community Health Improvement Plan. Along with this, the Hanlon method is used to complement the community's feedback in the vote. These key strategies are now combined and become our Community Health Improvement Plan. The community was given a chance to vote using ballots such as these that were distributed throughout the year at various community events. At the same time, the list of potential community health status indicators are calculated using the Hanlon method. In brief, the Hanlon method figures the size, or how many people are affected by this strategy, the seriousness, how bad is it to have this problem in our community, and the availability of interventions. How many proven interventions are there for addressing this strategy? In other words, best practices. These data are then gathered for each strategy and scored. All of the data and scoring methods are available. The formula at the bottom of the screen shows the total score. Finally, each indicator is then tabulated and listed in descending order with the highest score first. Here are the results of our strategy prioritization, with community ranking on the left side and Hanlon ranking in order on the right side. The strategies may be too small for you to see, but they include strategies such as increasing prevention education of gang violence, increasing number of available psychiatric services, lower rates of obesity through increased physical activity, lower rates of obesity through better nutrition, increased prevention education of teen pregnancy, increased prevention education of teen substance abuse. Once the prioritization and selection process is complete, the actual community health improvement plan can be introduced and presented to the community. How it is presented in the community health report now becomes a challenge of graphing design. That is, how best to graph the data represented by each indicator in a way that will be very easy to understand in not only a static representation, but also to clearly show a trend of where this data seems to be headed. The target audience for this report, remember, is not other nurses and scientists, but rather the community at large. Finding just the right way to represent this data in a way that will engage the reader and inspire follow-up action is the final step to the new chapter in Public Health and Community Alliance, a true partnership that realizes the value of community feedback. I'm George Kovach, and I thank you for watching.